When we're talking about like mental health, how does your mental health contribute to burnout?
Well, think about it. If you are feeling exhausted, if you are feeling anxious all the time, if you are feeling depressed, if you are just feeling disconnected, feeling without purpose, these are all things that impact then your physical energy, never mind your emotional energy. And yet, in order to function in our work, which we often continue to do way past the point of practicality, the energy it takes to suppress what's going on, manage what's going on, hide it from people, that in and of itself is exhausting.
Yes.
Right? And if we could, as what you're doing, create an easier way for people to get help earlier on in the process and not feel ostracized, not feel a failure. It may not be prevention because it's already going on early on, but it can prevent this whole cascade that then results in somebody getting to the point where they have to walk away, or they suffer very physical consequences of all of this stress, all of this stuff that's been running around in their body.
Yep. The goal of Hope for Med is to be a pop-off valve, just something to allow you to decompress, to allow you to continue working and doing what you love and not getting to the point where you throw your hands in the air and say, I'm done, I can't do this anymore.
Yes. Once you get to that point, it's really hard.
And the thing about it is that our jobs are hard. It may not be manually difficult. Like, we're not doing a lot of manual labor. At least as physicians, we're not. Other healthcare professionals do more manual labor than we do as physicians. I will give them that. But it's mentally exhausting. It's emotionally exhausting.
Yes. I mean, you're constantly worrying about, did I do the right thing? Did I give the person the right answer? Did I figure this out? Did I miss something? And emotionally, you're dealing with all of the emotions of your patients. And it's very hard not to take them on some level. Even though we like to think we can be disconnected from that, we do take them on. And then our emotional responses to what goes on. We have a patient that dies. You have a patient that has a complication of some treatment that you offered. You have the feeling of failure when you can't provide the answer somebody needs. All of these things create such an invisible burden.
Yeah. And I think that this is the stuff that we don't talk about, that needs to be talked about.
Yes, absolutely. And I think one of the core themes I see weaving throughout so many clinicians that I've worked with is that loss of locus of control. And that compounds everything. I think a lot of us cope pretty well, not saying ideally, but when there's a sense of loss of locus of control, along with this loss of purpose, it's devastating.
Yeah.
Yeah. So when you have something like Hope for Med, you can reach out, if that safety valve let off a little steam, get some support and regroup and regain some of that sense of, I'm okay, I'm in control, there are things I can do. And I think that is incredibly powerful.
And you don't have to explain yourself.
Right.
You just start where you are, because we understand.
For us, by us, and just for us, this is Hope for Med.